Welcome. We are honored to be with Dr. Constance Okeke, author of the Glaucoma Guidebook and founder of the Age Initiative. My name is Rachel Krug. I'm the CEO of Virtual Fields. Dr. Okeke, would you like to introduce yourself?
Sure. Again, my name is Dr. Constance Okeke. I am a glaucoma specialist and cataract surgeon based in Norfolk, Virginia, at Virginia Eye Consultants. I'm also a assistant professor of ophthalmology at Eastern Virginia Medical School, where I teach residents and medical students and do research with them and lots of projects like the Age Initiative. I'm really excited to be here and be able to share information about glaucoma, especially in honor of Glaucoma Awareness Month.
Awesome. Thank you so much. Let's dive into the content for today. Um, Dr. Okeke, in the Glaucoma Guidebook, you describe what glaucoma is, why a visual field exam matters, and even more in very easy to understand language. What inspired you to write such an approachable, accessible book?
Well, interestingly, this is actually my second book, and the first book I wrote was about was for doctors about a MIGS procedure, a microinvasive glaucoma procedure, and it was really in me to do something for patients. And um, one of the reasons why I wanted to do it was because there were so many situations where a patient would come to me and they had maybe been diagnosed with glaucoma in the past, maybe didn't really understand the diagnosis or got lost to follow up, and now I'm seeing them and they've lost a lot of vision. And there's only so much that I can do. I can only try to help preserve what they have. I can't restore. And inside you're feeling, just I wish I got a hold of you earlier. I wish you had more information earlier. And it was really to be able to provide something that was very approachable. I understand in this day and age, people want information now. They want it quickly. They don't always want to dive into some dense book, and especially don't want to have something where they feel it's going to be over their head. I know people are very visual, so I wanted to make it something that wasn't too dense, was full of pictures, things that would make it easy to understand, and also the information that I could give them that I can't give in the office setting because I can't. This is the information I wish every patient would know. I just can't give it all at one time. So that was really the mission behind the book, to provide education and empower patients so that they can do their role, which is a very important one in glaucoma care.
Thank you for sharing that. In the book, you mentioned that the optic nerve is like a lamp's cable cord, and so there's several other analogies in the book as well. How did you think of that analogy? Why do you think using analogies is important for patient education?
Well, that particular analogy kind of came up with I was piecing different things together and actually being tasked to try to explain it in a way that I thought was visual for people to understand. When you think about the optic nerve, it's the cable between the eye and the brain, and signals are sent. And if that optic nerve is damaged to a significant degree, even if all the other structures in the eye, like the lens or the cornea or the retina, even if they're or the lens or the cornea, like a cataract, even if they're intact, um, you won't be able to see if the glaucoma, the optic nerve is very damaged. And so then when thinking about, well, what's that kind of like? Well, cutting off the cord, cutting off the supply. And I thought of, well, there's like a light switch, right? So if you have a lamp and it has all these working parts, and it's plugged in, you can see there's brightness. But if the lamp cord is disconnected, damaged, then even if all the other parts of the lamp are working fine, you won't be able to see. It won't be useful. So that's where that kind of analogy came from. And then there's another analogy in the book because I wanted to further expand and not say it's like lights out and lights off. It's not like that with glaucoma. It's a gradual process, and how it's sneaky in the sense that you could be seeing maybe not quite as well, but you don't really realize that you're not seeing as well because you're still functional. Okay. And when understanding that you could lose over half of your optic nerve tissue and still function fine and see well, that's kind of the concepts I wanted to try to explain in visual formats.
Awesome. Thank you. Shifting gears a little bit, you've also started the AGE Initiative or Advocates for Glaucoma Education. Could you tell us a little bit about why you started this initiative and what AGE the mission is?
Yeah, so AGE Initiative, AGE stands for Advocates for Glaucoma Education, and it started about a year ago. Last year in January, I launched the book, the Glaucoma Guidebook, and in that process of the month of January, there's a number of activities that I did to promote education with various audiences, from doctors to patients to staff to students. And what I realized is right after the month of January, a lot of things just kind of died off in terms of excitement or discussion and opportunities that were there for talking about glaucoma education. And glaucoma is not something that we just address in January. We have to address it all year long. And so I wanted to do something to promote education throughout the year. Also, during that month of January, one of the events that I had was at the Eastern Virginia Medical School, talking to them about glaucoma and also career in ophthalmology. And after that session, quite a number of students had come to me very interested in ophthalmology, eager to see if I could mentor them or be involved in projects. And so, with that motivation to try to adhere to their requests, and then also thinking about how we need to work on projects throughout the year promoting education, that's kind of how the AGE initiative was formed, to try to help foster education, but also mentor these students, because there is a need for more ophthalmologists to continue the care as we have a growing population, and especially an elderly population where a lot of these conditions become more apparent within the eye. But yes, to mentor, and then to also, our mission with the AGE initiative is to creatively combat glaucoma blindness on a global scale. And so, with the different projects, different collaborations, audiences from doctors to industry, staff, students, and then patient population, all of these things to try to encourage education and awareness.
Thank you for sharing that. It's great to hear about how you're contributing to the profession in that way. Could you expand a little bit on the Age Initiative, particularly around your plans and goals for 2024?
Yeah, so one of the things that in launching it last year, getting a lot of people interested in projects and things like that, realizing that we also need to focus in and try to have certain goals that we'd like to accomplish through the year. One of those goals is research. There's a number of projects that we've started, gathered, collected data. Really want to hone in and analyze that data and produce some publications in the area of glaucoma research on MIGS, minimally invasive glaucoma surgery, and glaucoma patients who've had advanced technology lenses. Also, we want to expand upon our reach in terms of online presence. And so, right now, we have most of our education and our resources are through LinkedIn, but we're expanding to Facebook and also having YouTube presence with more videos in order to try to encourage education on multiple levels. We also would like to work with certain industry and nonprofit organizations that are interested in helping us put video series together. One video series we'd like to do is on the patient journey, being able to help educate the population on the different aspects of living with glaucoma. And then also live events. We recently did an event in Nigeria. We had a medical mission where we brought medications and brought ability to screen patients for glaucoma, brought glasses, reading glasses. We'd like to do also additional events. We have one that we want to plan in the near future of another event here live in the somewhere in the local Virginia area for our glaucoma patient population. Also talking to them about education, how to use eye drops, giving them opportunities to practice that, as well as learn about different technologies, treatments, and then giving them opportunity to talk about patient experiences. So those are the areas that we'd like to focus on mainly for this year.
Amazing. So in addition to this webinar today, Dr. Okeke, we've also collaborated on a blog post on patient education for the Virtual Fields blog. And in that, we quote you as saying, "A best practice for patient education is simply remembering to give it." Could you elaborate on that for the audience today?
Yeah, I think that the reality is that we're all getting more and more busy with our practices, and when we have a patient in front of us, we're really supposed to do a lot in a short period of time. Gain a person's trust, understand what is going on, make a diagnosis, then have a plan, and let them know what that plan is. But sometimes in all of that, there's need to kind of pause, ask questions to dive into what is actually going on, if there's some changes that are happening, and trying to figure out why those changes are happening and how to adjust the treatment plan. There's also a need to educate people on, exactly what's happening, and so that they can be more on board. And there's a lot, and it's not always easy to educate, but it is important to educate and remember that even if I can't give it all right now, I have resources that I can direct you to, that you can get further information that's validated. That's the main reason why I wrote that book. Wrote it not just for my patient population, but for the patient population at large, because I know that educating the patient is important. If they understand why they're doing what they're doing, they're much more easy to comply. And it's also important for them to understand that they need to ask questions or speak up, because if they don't speak up, sometimes we as providers may go a certain route that might not be the best for the patient, but if we don't know, because the patient is too, apprehensive to talk about it, then we don't come up with the best plan for them. So it is something that needs to be a two-way street. When you give education, people get empowered now that they're able to have a good conversation. But hey, I didn't use the drops because either they bother my eye, I can't afford them, as opposed to, oh, your pressure's not good, we'll add another drop. Well, if you don't say that you had all those problems, you just say, okay, yeah, you take that drop, you don't use it, you're not solving the problem. We're not doing what we really need to do. It's better for people to understand that they need to talk. And so my point is to say that if one can't give the information at the time of the visit, there are resources like the Glaucoma Guidebook, and there's also other resources out there. A lot of organizations I work with, like the Glaucoma Foundation, the Glaucoma Research Foundation, Prevent Blindness, Bright Focus, all of those places actually have really good resources for glaucoma for patients that are free. And so it's for us to also let them know that there are resources. And some of those resources are very supportive for the patient. And glaucoma patients do definitely need support. So it's for us to, if we can't give the information at the time of the visit, give them and point to the resources where they can go to get that information that will help us as providers take better care of our patients.
That makes sense. And in both in the book and in reviews, public reviews of yourself, congratulations. You are clearly a very supportive resource to your patients. They really enjoy um, being treated by you. What motivates you to continue to provide that level of care, literary resources, visual resources as you practice?
Um, I can one say that I do feel that ophthalmology and glaucoma in particular is a calling for me. For whatever reason, I'm just set on and get a high off of learning about glaucoma and educating others about it. I do feel when you share information and you see light bulbs go on, or you see people melt with just relaxation of reassurance, or you can feel it. And so when you get that in response to what you're giving, it encourages you to want to do it more. And I know how I feel sometimes when I've learned something that someone shared with me and it's helped me, and so it's like you kind of want to also give back. And so I continually get encouragement for doing these things, and I feel that I'm supposed to, and I'm grateful to have the opportunity to do it, and it just keeps cycling. So for whatever reason, I'm trying to utilize my talents to the fullest. And if that's being able to articulate and explain to people about how to take better care of themselves in a way where they can understand, and now they're empowered to do it, they take action, it's helping the society. So I'm grateful to have the opportunity.
Thank you. How do you think physicians can improve patient communication, and why is it important to advocate?
Well, I think that they can improve patient education by just taking an active role and trying to support it. For example, being a part of the AGE initiative, we're looking for people who acknowledge that in providing education and awareness makes a difference. And like, for example, uh, I've had a staff member who read a portion of the book and had a patient in the pre-op area for surgery a patient's family member expressed how they were having difficulty putting eye drops in. And that staff member brought the book and opened up a page to show them, instructions on how to use their eye drops. And they, said, "Oh, wow, this is going to be really helpful. This is okay. That's why, maybe he shouldn't be doing it that way." Okay. And it just made them feel great to be able to get that little piece of information, which we may not feel as much of a big deal, but to someone who that's not their area of focus, or that's not just they just don't know how impactful it is to share that information. And so I think that as providers, also as we advocate, like I said, we feel people will come back and tell you that you made them feel good, and it makes you feel good to provide that. I mean, that's part of the reason why we went into medicine, in order to help people. We learn this information, we share it, we treat, and we heal. And so we have that, that gift to be able to do that. So the more that we do it, the more that you can gain a sense of feeling you're doing what you're supposed to. It just makes you want to keep doing it.
I love that. We share, we treat, we heal. Very well said. Speaking of eye drops, in the book you mentioned how to manage glaucoma and dry eyes. Would you mind elaborating on how glaucoma drops might contribute to dry eye and what providers can do to help patients combat dry eyes in glaucoma?
Yeah, it's important to keep up with understanding that part of the treatment for glaucoma is not just the pressure coming down and yes, halting the disease based on exams and testing, but also we have to be acknowledging that the patients need to tolerate the regimen well. Because if the patients are irritated or they're red, they may not be using their drop when they're not in the office. And we've done studies before on patients who we've monitored and realized that a patient can not be using their drops in between visits, and then all of a sudden, right before the visit, start using the drop, and then you see that their pressures are okay. And you're like, okay, your pressure's good. But then you might be saying, well, why is that visual field getting worse when the pressures are always good? You have to dive into finding this information. Are you doing okay using your drops? Do you have any reason why you have trouble getting your drops? Is it cost at the pharmacy? Do you have trouble remembering? Does a drop bother you? Those direct kind of questions can tease out what the real crux of the problem is. And let's say it is that their eyes are irritated. Well, there's the potential for either reducing the number of drops with other procedures like SLT, selective laser trabeculoplasty. I call it light energy treatment. There's also the possibility of lessening the drops. Maybe there's multiple drops. You can compound them. There are either drops that are two in one, or there are companies that compound medicines that can put 3 and even 4 medications in one bottle. There's the use of preservative-free medications. Sometimes even switching one drop that has preservatives in it to another drop that's preservative-free can make a huge difference in terms of their tolerability level. We have preservative-free Iusa that's come out, that's lantanopros preservative-free. We have preservative-free Cosopt, both in a name brand and a preservative-free format. We have preservative-free Timoptic and Ocudose. So those are medications that can be used. We also have Xioptan, which is a PGA that's preservative-free. So we have options with that. And then sometimes you might even need to consider MIGS, because sometimes the patient is just not doing well with like their 4 drops, and or their 2 or 3 4 drops, and their surface is really dry and irritated, and they've already had laser treatment. And what's the next best step? Well, if they can't keep up with those medicines, we need to think about some of those other options, and they may be a standalone MIGS procedure. And so I think it's important for us to address those things as they are important, and provide options for our patients. Let them know that these are options. Even Durista is another option to consider.
Thank you. That was very informative. As part of hosting today, we are raffling off 3 copies of the book to registrants. If someone isn't lucky enough to be one of those 3 winners and is interested in the book, where can they purchase it?
Yeah, well, the book is published by Johns Hopkins University Press, and so on their website, the Glaucoma Guidebook is there for you to be able to get access. It's also in stores like Barnes and Nobles. It's also on websites like Amazon. If you do consider purchasing it on Amazon, I would love to ask if you would place a review. You all know that reviews help patients to be able to find great resources. And I would love to have a review from you after reading the book.
Awesome. Will do. And we've already purchased several copies for our team here at Virtual Fields. We will certainly leave you a review. Thank you so much for your time today. This was very informative. Thank you for the walkthrough on some best practices. We really appreciate your time, and we were honored to be with you. Thank you so much.
Thank you for having me. Thank you so much.